Chapter 20, Assessing the Anus and Rectum. The rectum and anus are, again, intimate parts of the body, and the nurse needs to be professional and sensitive to the patient's feelings during these assessments. This is pretty much the same assessment for both the male as well as the female. The rectum's primary function is to store processed fecal matter. Large intestine opens into the rectum, and there are a number of sensory nerves and transverse folds that help to hold the fecal material. The anus is located in the perineum. It's pretty much the end point of the GI tract, and there is the internal as well as the external sphincter of the anus. Bowel movements are important information to collect from the patient. Bowel movements include the pattern, change, size, diameter of the stool, if they have a history of constipation or diarrhea. Box 20-1 in your book on page 397 goes through diagnostic criteria for functional constipation. Hematoschisia, just kind of break that word in half, blood. The color of blood gives you clues to where the bleeding is occurring. The darker the blood, the higher up that bleeding is in the GI tract. The more red, the lower it is in the GI tract. When you are collecting information from the patient, you want to ask them about rectal bleeding if they have any. If they've identified where that rectal bleeding is coming from, whether they have a history of hemorrhoids, polyps, if they've been told they have an anal fistula or fissures. Is there any pain or itching in the anal region, and is there any abnormal drainage? Do they have a family history of anal cancer, or do they themselves have anal cancer history of? During the health history, the patient reports bright red blood in their stool. What part of the colon do you suspect this blood is coming from? If you said D, you're correct. Again, the brighter the color, the lower in the GI tract the bleeding is coming from. A female patient comes to the medical clinic complaining of rectal pain. She says she's very anxious to be examined. What should the nurse say? If you said B, you're correct. The anus and rectum are assessed at different times for the female and male assessment. Female patients are assessed after a pelvic assessment, and male patients are assessed after the male genital area, and with the anal assessment, the prostate gland is also assessed. Again, it's inspection first, and then palpation through digital rectal exam, and a collection of the stool can also be conducted to determine if there's any blood. So, inspecting the anus, purpose is really to identify any abnormalities. Gloves are required, a good source of light is required, and patient's positioning is also going to vary in this examination. When you're inspecting, you want to look for any redness, inflammation, lesions, lumps, any wounds, any areas of excoriation, hemorrhoids, or fissures. You want to make sure that the anus is tightly closed, the skin is moist, there might be some hair present, but there should be no redness, inflammation, lesions, lumps, hemorrhoids, or any fissures, which are just cracks in the skin. You're inspecting the anus and note protruding, swollen, dilated veins. What do you think you're seeing? Hemorrhoids. Those are simply swollen, dilated veins that protrude. Usually patients will have some bleeding, some irritation, some itching. hemorrhoids can be associated with constipation. Hemorrhoids are very common in pregnancy and pregnant women, especially towards the end with all the pressure. Preparation for internal rectal. This is an advanced assessment, but I'm going to go through it. So again, you want to make sure that you're educated on how the assessment is conducted and that you're preparing your patients also with these. Again, very uncomfortable exam. It's a very sensitive part of the body, but encourage the patient to let you know that if they're experiencing any discomfort, but also maintaining dignity and privacy at the same time, and respect. So performing a digital rectal exam, the purpose is to identify any abnormalities, especially in the male population, with the rectum and the prostate. A rectal exam can be done using, having them in different positions, and I'll show you these different positions. The side lying, the lithotomy, or bending over. So I think it's patient comfort, as well as kind of identifying what is the best position for the patient. If they're an older adult, limited movement, maybe the side lying would be better than the forward bending. The lithotomy, usually that's done with or after, in the females, after a pap smear. So they're already kind of in that position. So again, ask your patient which is more comfortable, and really, clinical judgment is the most important. Gloves and a moderate amount of lubrication to your index finger is required for this type of exam. Gently touch the anus with your index finger and ask the patient to bear down as you gently insert into the lower rectum. Assess the rectal sphincter muscle tension. In the male only, move your index finger so that it's positioned anteriorly, pointing towards their umbilicus or their belly button, and you're just palpating the prostate gland at that point, looking for shape, size, smoothness, lumps, and tenderness. And it should feel heart-shaped. There should be no tenderness. There should be no lumps or bumps identified anywhere. You want to, with the rectum, kind of assess in and around, look for tenderness, any lumps, any masses. If there is any fecal matter on the glove, you could use that to culture and look for any occult blood. Send that to the lab. Normal findings should be, and this is actually opposite. I don't know why this is opposite, but normal findings should be that the rectum is without tenderness, masses, or hemorrhoids, and the male prostate, again, has 2 smooth lobes within normal size, no nodules, and non-tender. The fecal occult blood test is simply to identify if there's any hidden bleeding that might not be visible to the naked eye. The setup is by opening up the side for the sample application. Put on gloves, apply a sample specimen to both of the windows on the slide. Close and then send to the lab. And sometimes you can actually do this in the office as well. Whatever specimen you have. Some offices will send it out, some will do it in office. A middle-aged patient is complaining of fecal incontinence. Which assessment technique would you expect the nurse to perform first? And if you said D, you're correct.